This is Dr. Gary Wiltz, the CEO of Teche Clinics. And for those who don't know, we have locations in 6 parishes, St. Mary Parish in Franklin on Weber Street, Morgan City, Pierpont in Assumption Parish, 2 locations in Terrebonne Parish at Houma and Dulac, also 2 locations in Lafourche Parish at Thibodaux and Galliano, and also locations in St. John at Edgewater and Reserve. We also have some school-based clinics, but they're currently closed with the mandatory school closing. Just wanted to give you an update on the COVID-19 or coronavirus pandemic that we're experiencing. Let me just say right off the bat that Teche Clinic is open for business, even though we're in the middle of this pandemic, and I'll go over some of the measures that we're taking. We know that the coronavirus is not the only illness that is out there. We still have lots and lots of patients, obviously, that have diabetes, hypertension, heart disease, and chronic conditions that also need care. So those folks have to be tended to also. But we are taking measures to decrease the stream of patients that enter through the doors. So one of the things that we were just mandated by the Louisiana State Board of Dental Board, that all non-emergency and elective procedures be halted. So our dental practices, both in Franklin, Morgan City, and Houma, have been curtailed, and we're only accepting what is considered emergencies. That's people with dental abscesses, and pain, say a chipped tooth or a broken tooth or filling that came out, or those sort of things, and we're asking those people to call for emergencies. The procedures that we have in place, we're asking people that have any high degree of suspicion and symptoms that they're concerned about to call ahead and give us that information so we can identify them before they enter the building. Those symptoms are being if they're having fever, if they have traveled to a hot spot, if they have a cough or respiratory symptoms of shortness of breath. Of course, if they're having severe symptoms, then they need to go to an emergency room. If they're having severe shortness of breath and can't breathe, the best thing is to seek immediate medical attention at a higher level facility than just an ambulatory clinic. So once a patient, what we're doing right now is every employee, before they enter our building or immediately upon entering, before they get into any patient care areas, or screened for temperature, and they have to be have a normal temperature, or certainly below 100 before they're allowed to work. We have identified, and we're doing the same thing for all visitors, all vendors, and all patients. As they come in, we're doing a series of screening questions and then checking temperatures to make sure that if folks do have a temperature, then we isolate them. The protocol is that we would take and check them for the flu or strep throat if they have a sore throat. If those are negative and the questions are high enough, then we would screen them by doing a swab for COVID-19 and then send them home into self-quarantine. The public needs to know there is no immediate test that's available. It's taking 3 to 4 days to get test results back. So we ask people to self-quarantine until results are determined. Of course, self-isolation and all the things that you've heard about as far as covering your cough, making sure that you are practicing good hand hygiene by washing for at least a minute with soap and water, or using a 60% alcohol-based hand sanitizer, and practicing social distancing, which means that you have to be 6 feet away from the next person. They've already banned any congregations of more than 50. And there's talk about that being even decreased. So this is a pandemic that we're in, and we don't know the full effects, but most experts are saying that we probably are behind because we started testing late. The only way to figure out what the penetration is to keep testing and testing. And the more you test, and the more you can see those that were symptomatic and the ones that have more severe cases, and that's how we determine what the mortality rate. We know those that are highest risk are the people that are over 60 and have comorbid conditions. That is, they have more than one medical condition. That is, if you have diabetes, hypertension, heart disease, lupus, anything, a history of cancer, immunocompromised patients. The particularly most affected seem to be those in the higher age brackets. Those that have been in nursing homes are particularly vulnerable. The hot spot seems to be New Orleans. Unfortunately, New Orleans is per capita, if not the highest, one of the highest in the country right now. As far as I keep getting asked the question, how do I think this thing is going to go? And if you've been following the news, when you look at the curve of cases that are diagnosed, it's rising, and we expect it to continue to rise. The whole idea is to, if you can get to that peak and then the curve starts flattening and you're not having new cases, then you reach a plateau and then hopefully it start dropping off. The best practice is to not congregate, socialize, distancing, and to self-isolate. If you don't have to go out and congregate, then that's the best thing. We've canceled lots and lots of venues. As you know, there's no in dining for restaurants. Church services have been eliminated for the most part. Wedding receptions, all those things that people tend to gather for have been, even funerals. They're asking that people have just graveside services with immediate family. So at this point, because we are behind, because we did not test aggressively in the beginning, we're now left to trying to isolate people so they can't make this very contagious virus pass on to each other. It can be passed on from sneezing. It becomes aerosolized, and if it enters through any pores like the nose, the mouth, or the eyes, or if you touch something and touch your face, that's the other thing we're asking people, is to keep their hands away from their face, their mouth, their nose, their eyes. It can last on surfaces, it depends on the surface, anywhere from 2 hours to several days. On the hopeful side, 2 days ago, Kaiser Permanente in Seattle did administer the first test vaccine. And that person obviously got inoculated, and we'll see what happens with that. But on general theory, it takes about a year for a vaccine to be developed. But just know that people are aggressively researching around the clock. There also has been some reports of some early success with some retroviral drugs that they've been using experimentally on clinical trials to treat folks who have the pneumonia associated with COVID-19. So the best thing is to get the right source of information from a factual source. The most factual-based source in the world actually is the CDC. And then also the World Health Organization. They have a very good video that demonstrates hand washing that you can look up in Google. But the CDC, listen to your local and state officials for any updates as they come out. The grocery stores are still open. I think they're monitoring kind of how the flow is going in some places, and they have made some special accommodations for senior citizens. And we need to be mindful. That's the dangerous thing about the virus, is some people are carriers and they're asymptomatic, and if they get around someone that's immunocompromised and they get it, then it puts them at risk, and we certainly don't want that to happen. They've limited visitors at the hospitals and the nursing homes, and as I said, we are also doing the same thing, and we are, as I speak right now, in the process of developing telehealth services at Teche Action Clinic. CMS has relaxed the rules that we may be able to do face-to-face phone visits, which will eliminate the need for people to come in. We've also just instituted in Franklin, we're probably going to spread it to home soon, is home delivery of medications. So our pharmacy, we will be home delivering the meds for those that we're able to, as a service to help decrease the influx of people that are just coming just to pick up their medications. So once again, you know, the old adage about fearing fear itself, I think, is always true. I guess being philosophical, historically in the country, when one area is affected, we've been very good as Americans. As we all know, in South Louisiana, when we've had hurricanes and inclement weather, we've received help and aid from all over. Just as when 9/11 happened, we helped the folks in New York, California when they had the wildfires, tornadoes in the Midwest. That old adage about we all came over in different ships, but we're in the same boat together, has never been truer. So there is no, let's go run and help that state. Oh, let's go help that state. We're all in the same state of affairs. And the best thing that we can do is help our neighbors, help our families, help our communities, and practice those good social graces and hygiene that I mentioned earlier.